Thank you so much for the introduction. Yes, my name is Romana, Ruda, Managing Director from the Future Health Lab in Vienna. And let's not waste any time and start into the discussion round. Very, very short intro from myself. We face two, or let's say minimum two divides. The socio-economic divide you all know, with older people, less IT literate versus very tense, let's say very limited financial and human resources in the healthcare system in Austria. Technology could theoretically support to manage this divide, but we face another main challenge. We have the rapid technology development on one hand versus what finally reaches patients and other stakeholders in the health domain, on the other hand, due to tough regulations, fears, reservations, and so on. So I'm looking forward to interesting thoughts and ideas to bridge these divides, and say welcome to the 6 panelists for the next, yes, we mentioned it, 30 minutes. I really changed my plans in the moderation, because I fear we'll maybe only do one round, but we will figure this. Let's jump into it, and let's invite as ladies first. I want to start with Geja Oostingh. I see you on the screen here also. You're head of the degree course Biomedical Sciences at the Salzburg University of Applied Sciences. And let's start with a very open question in our discussion round. What is needed, in your opinion, to widely reach patients and other stakeholders in our healthcare systems with digital health solutions?
Thank you very much for inviting me to this panel. And we are, of course, more from an educational point. And so I'm also head of the department, health sciences. And we are educating the nurses, the midwives, yeah, all professions except for the medics. And I think we need to start really with education. So the people in the healthcare system, they have to accept those tools. They have to see why those tools actually make life better. And if they find out what's better when they use a tool, then they will also propagate it to their patients. They will tell them, hey, go and use this tool because it really makes your life and my life easier. And only if that happens, we can actually manage to get there. And I think in order to do that, we have to start also with the projects, the research, to really get them into our education. Try out stuff during the courses, so that the students already at a very early point notice what they can do with those tools.
Thanks for this. Just if you jumping into the topic, making the focus on the necessary educational step for the first. Let's jump over to Angelika. She's on the screen now, as you mentioned it, and then look into my head. Angelika, hi. You're a researcher at the Austrian Institute of Technology, and you are coordinating many projects focused on integrated care, aiming to improve healthcare delivery by connection various healthcare services through digital solutions. And yeah, as an expert, you are convinced that digital transformation can help to realize an integrated care across all sectors. But honestly, why is it so difficult to inspire patients on one hand, and maybe also health professionals on the other hand, even though we know that digitalization could help us to bridge sectors in our very complex healthcare system in Austria? Or are they inspired enough?
Well, I guess I have 4 points to mention here. So first of all, I would say that patients are inspired because there are integrated care solutions out there. I mentioned Herzmobil here. probably many of you know the solution for chronic heart failure. And we proved the feasibility and also the cost effectiveness of this digital solution. And because you also ask what could inspire, I see that you have to meet certain success factors, for instance, defined in the information system success model. So you always have to ask questions when having digital solutions in routine care. And those factors that you have to look at are, is the information quality good? Is the service quality good? How is the user satisfaction? How is the usage intention, and therefore you can calculate the net system benefits. And if the system benefits are visible, then the solution will be used. And another factor in close connection with this one is interoperability. We've already heard from Helene before, but you cannot expect health professionals and patients to use 20 different apps and solutions. So you have to build those systems so that they can incorporate each other and communicate to each other. And last but not least, patients will not have to pay for those solutions. So yeah, you will have to find financial performance allocation in the form for the health professionals, so that they are able to reimburse those services that go together with all those digital solutions. And if all of these factors are met, then yeah, then problems are solved.
That looks very, very easy in the theoretical way, but I will come back to this a little bit later, I guess. Let's look a little bit on another special target group, let's say to the health professionals. Janne Cadamuro, you're an associate professor and currently serve as the interim head of the Department of Laboratory Medicine at the University Hospital Salzburg. In my personal opinion, it's my personal opinion, I think there is no other digitalization topic which is currently triggering such heated debates and major upheavals as artificial intelligence in the healthcare sector. What's your experience with that? And the second question in this, are especially health professionals in Austria really ready and willing for using digital health solutions?
Well, first of all, thank you for having me. Yeah, so for your first question, the AI in health, it's a complicated topic. I have been appointed as AI, I don't know how you call it, AI dude in the in the hospital here. And in this function, I have talked to many people, and my impression is that there is a lot of engagement in this topic, and some people have seen the possibilities, and the thing is that there is missing communication between these people, but we're building that now. And the second most hindering thing on really going forward is data, meaning flagged, structured data, interoperable, so fair data, findable, accessible, interoperable, and reusable. So this is the thing. And in healthcare, it's usually is kind of hesitant or restrictive new technologies towards. The reason for this is actually patient safety and patient data safety. So it's not because people don't want, some, especially the elder ones, surely are more restrictive because of they don't want. But on the other hand, if I always say if Alexa makes a mistake and understands something, misunderstands something, that's not that big of a deal. But if an health AI, which helps you in interpreting test results or giving you guidance on diagnosis, if this makes an error, this can be really catastrophic. And therefore, before implementing anything in healthcare, it has to be validated rigorously. And until now, this has happened only for image recognition. So for radiology, cardiology, now gastroenterology is on the move right now. But for example, in my profession, laboratory medicine, there are so many variables you need to understand or be able to interpret these test results in a synoptic view, that no AI is able to do that until now. So we have tested that, and until now, it's really it's basically you can dice the result. That's better. And now I forgot your second question.
The second question was if especially the health professionals in Austria are ready and willing for using digital health solutions.
All right.
It's such a cultural aspect.
Yeah. Yeah, so I recently had a talk in front of general practitioners here in Salzburg, and they were also queried by the moderators there. And one of the questions was, which of the following models have you used at all? So private or for any other maybe health-related topic. And to my astonishment, I think it was between 30 and 40% have not used AI at all. So no LLM, no whatsoever. And I think that when we talk amongst each other here, we're living in a bit of a bubble, thinking that everybody has implemented AI in some way. But I think the majority, and even educated people like doctors and general practitioners, even there, a third of them has not used AI at all. So I think the first thing we need to do is to, first of all, come up with the needs. So asking the people, what is it you need the most? What is your greatest burden in your daily routine? And then see if AI can help there, then make them literate in AI, educate them, and so on, and then a feedback loop then evolve over time. But first of all, I think you need some quick wins for especially those people who are still hesitant against it. Because after the talk, I had really nice discussions with some of the people there, and came clear that it's a kind of a fear of the new, of the change as usual, right? So I think we need we need to start far lower than we think.
Okay, I think we will come to this that back a little bit later. Let's follow up the round. Yes, right. I'll welcome Gunnar Treff here in our round. You're a senior sports scientist and exercise physiologist with a very diverse background at the Paracelsus Medical University at Salzburg. I also want to ask you which barriers on one hand and which enablers for widely implementing digital health solutions in practice do you see in the Austrian healthcare system?
Yeah, thank you very much, Romana, for inviting me and having me here. As you said, I have a background in exercise physiology, also in high performance sports, and here I'm basically working in rehabilitation research. And what we see is what I can see here is very similar to what I saw before in high performance sports. People to accept systems collecting data, they need, at least in my experience, and there are also good data indicating this, they need trust in data handling, and they need a feeling that they need to know that their data are private and that these data are their data. I think this is very important, as long as it's not possible to provide this in a way that at the same time allows to work with these data and to gain benefits for those who are working with these data. the thing won't work. I think this is very important. So trust and privacy, and on the other hand, benefits. What are benefits? One benefit, as we said, for example, more resources for the healthcare professionals, which are an extremely heterogeneous group. We have to keep this in mind. We have doctors, we have a radiologist working with image capture, but we have, as Janne just said, other doctors working in very different fields. And in their lives, AI is obviously not daily business. We have physiotherapists who are mainly working with their hands and so on. So this is an extremely heterogeneous group. And this brings me maybe to the last point, because I want to keep it short. I think we should accept that this is more a societal approach that we have here. We should not just focus on, for example, patients. We should focus on the society before they become patients, because this is something we learn here in rehabilitation research, and we have a strong collaboration here, for example, with all these great partners here in this panel talk, here at the PMU, Paracelsus Medical University, and the hospital. We have this collaboration, and this collaboration will help us to see that, to understand how the state of the people is before they become patients. And this will allows us to improve, for example, rehabilitation concepts, to personalize rehabilitation. And this is something we learn here. And I think this is very important to understand, or at least from my perspective, it's a societal approach that we need.
Thank you for this. I will come to that back later also, and to challenge it a little bit, because for myself, I find it very necessary and very important to get in more collaboration forms. Let's continue with Susanne Ring-Dimitrou. You solved your technical problems in the background. You're a full professor in sports science at the Department of Sports and Exercise Science at the Paris Lodron University of Salzburg. You see, I hold your introductions very short so that we can step into the thematical discussion. Susanne, you devoted your career to the impact of physical activity and physical fitness on health, targeting untrained adults and children with metabolic and cardiovascular risk. So I would be interested in, do you have some success factors from your research, how we better can change existing habits and reach especially patients with innovative digital health solutions?
So thank you also to having me here in this panel. Hello, everybody. And with regard to your question, so what are success factors of changing behavior? Of course, it needs people around the target person that has to be supported. So we need social support that is really important if we look at children who grow up in the world of adults. So they need the support of this social network that has to be established. So there are some examples on the way if we think about the nurses concept or the community nurses and such aspects that could be helpful in this sense. But when it comes to digital solution and how digital solution can support a change, a behavior change to be more physically active as recommended, then the literature is showing, or evidence is showing, very diverse results. So to our experience, because I see also Siegfried Reich in the panel, we did studies in active assisted living environments. That means we supported older people to get active in their environment at home. And for us, the success factor was always to have a physical person as a coach together with the application. So this is one success factor for me. And when it comes to behavior change, that all digital channels that we use has, to my understanding, focus on one topic. And this is maybe, if it is physical activity, it means that we have a channel on education. So what is healthy physical activity? What do we mean with that? A second channel could be the Fitbit or a watch where we can monitor the physical activity. Another channel can be testing physical activity by self-assessments and so on. So we have a lot of communication channels as digital solutions, but focusing one behavior. So this is, if it comes to using app and to usability and user experience, I guess this is also important, because our experience was, if there are competing aspects, for instance, that people can also use the news channel on the application or use other functions, then the channel with regard to physical activity behavior change was not so successful. So this is our experience in the group, together with people from Salzburg Research Forschungsgesellschaft. And so if you ask me about success factors in this special aspect now.
Thank you so much for these interesting success factors. So we'll finish the first round. Last but not least, I welcome Siegfried Reich here at the panelist. You're Managing Director and Head of Research at Salzburg Research, an independent institute with know-how and sustainable solutions, especially for complex challenges in the Internet of Things. And I saw that one claim of Salzburg Research is from lab to field. So yeah, how can we successfully bring digital health solutions from lab to field? What are the main success factors therefore from your side?
That is an excellent question, Romana. Thank you for that. I guess simply looking at the panel we're having here means that we need not just one organization, but I think it has been mentioned several times this afternoon. Collaboration is key to success. We're talking transdisciplinary challenges. I think the very reason we're all on that panel is that there is several institutions supporting the Ludwig Boltzmann Institute for Digital Health and Prevention. It's the Fachhochschule, it's IIT, it's the University of Salzburg, the PMU. I hope I did not forget someone, the Uniklinikum, Salzburg Research, of course. Plus a lot of funding from the public government bodies. And I think the claim and the aim we have is moving things out from the lab to the fields. This is why we have that slogan, from lab to field. And the more projects we do with people in a real life setting, I think the more success we have. And it also means that perhaps we need more or longer term institutions such as the Institute for Digital Health and Prevention, because it takes some time until you're set up, until you have your reputation, until people recognize you. And if we keep doing this, then I think we will be successful also in not just convincing the people, the patients, but also the stakeholders, because they need to see that whatever we propose really works and works in practice. And again, this is the lab to field argument.
We can involve the society, how we can make them engage and bring them in an interaction, so that they also see the benefit that it's highly welcome to interact and to involve in such an abstract theme like the healthcare system. It's always so, it's the public system, and I don't have a stake in the game even when I'm ill, and then I have the expectation that somebody from expert side will help me. but I don't think that in the population we have the culture that it's also a good benefit for me to involve myself. So how do you see this? Maybe two action points, and do you have some concrete best practices from your research, from your daily business to share for the audience? So maybe we can open the whole panel. I think we can organize and match it. Siegfried, you will talk to me. I see it, but I don't understand because you're new.
I hope it works now. Yeah, I was not allowed to unmute myself,
Yeah,
which I think is...
So maybe we can open the whole...
Yes,
Due
now
to
we are
technical
all
reasons.
unmuted.
Yes,
Perfect.
I just thought we are perhaps all too much in an alignment on this panel. So I would say I kind of disagree with what you said, Romana, in that we have, at least in niches, good experience in acquiring patients, customers. And Susanne Ring-Dimitrou mentioned that we are doing a number of projects together. And I think it was always kind of okay and getting access to the elderly people, and they were with us and doing basically whatever we wanted to test or verify. The question was then, I think, once the project was over and talking to the other stakeholders that would then argue this is not in strict conformance with the process. It costs an additional amount of money, and who is going to bring it into a broader range of applications. So I think it's not so much about addressing the people, the patients, but it's more about convincing the stakeholders.
Okay, Geja, want to?
Fully agree on that. We've been trying also to get financing for participatory projects in different fields. And in Austria, at least, it's quite hard. We used to have from the LBG, the PIA calls, but they stopped. And nowadays, it's quite hard to get financing exactly for such participatory projects. And I also notice often that by other scientists, they're not really seen as scientific. So it's quite hard to get the audience or get the people who are really affected included and still keep the science at a high level. Yeah, so fighting with this point as a researcher.
Okay, thanks. Janne, how do you see this?
Well, thank you. I hate to be the negative one again. My wife always tells me to be more positive, but the thing is, I think you need a cultural change to get people to involve themselves in anything. So the first question is always, if you ask people, would you like to do anything, just anything? First question is, what's in it for me? And I have made many open source projects which should depend on collaboration or people engaging in platforms and so on, and it never worked out, never ever. And it's people are often seeing the benefit for themselves than getting what they need and then leaving again. I hope it is otherwise here in this situation. But I think if you really want to get people to engage, you would need to show them some other people who have benefited already from something you propose to them.
Yeah.
Thank you, Angelika. Let's jump in.
Yes, I really have to emphasize what Janne said, because we made the observation that the higher the burden of disease, the more willingness patients show to contribute and to engage. So in order to say with rare diseases, the engagement is much more higher than with like popular diseases. And yeah, I also have to outline, it's also that you have to show the system benefits again, and also to the patients. And you have to show that collecting that data is also a benefit for other patients suffering from the same disease. And you always have to work on them, convincing them that the benefits outweigh their concerns that they have regarding data privacy, for instance.
Thank you, Angelika. There is another hand rising. Gunnar.
Yeah, I'd like to be the positive guy here, and I think we can make it. I think we can make it. Of course, it's difficult, but we need situations that bring people into a situation where they spread the word due to having had a good experience. So how can we make that? I think a good timing is important for such interventions. It will be pretty difficult if we just start to try to bring people to digital health in every moment. But there are special situations where we know from research that a transformation makes people more open for starting new habits and for contributing. And such a moment of transformation is, for example, having a disease, having a cardiac event, starting a rehabilitation, and so on. And I think if we jump in these moments, we can create a situation that gives a positive association to those people having a good experience in a moment where they are really more willing to change things than before. And other disease management programs can be a good opportunity for that as well, because as we learned just a second ago, a high level of disease makes you want to participate in such projects. So I think these disease management programs are pretty good too. And the last point, I think, which is also important, which we as researchers, I think too often forget, is the the budgeting, to include socioeconomics. We often forget that, and once we do a research, we find out that it's pretty difficult to get these numbers. And I think this multidisciplinary approach, which Siegfried just lined out in the beginning of his statement, is pretty important. We need something that includes all of our disciplines plus something like socioeconomics, because the health economics will give us the strongest argument. I think that's important, and then we can make it.
Thank you so much, Gunnar. Susanne, let's jump in and before we start the very last round, because I have to look on the time.
Yes. Okay. What comes to my mind is that we have a lot of digital solutions of different types. So we can talk about this disease management program where we have an app and where we work maybe more directly with the patient. But when it comes to more complex system as ELGA or eHealth on this system level, then I guess it's hard to give the responsibility to the individual, to the patient, to solve problems. They expect from us that the thing is working. And so I guess we have also to differentiate a little bit which kind of solution at which level, and where do we need the participation of the target group to help us a little bit out, or how functions of digital solution can work or don't work. But if it comes more on the system level, then I guess the responsibility is in other hands.
Yes, the responsibility is a very, very wide topic. So I'd like to invite you for a very short last round. We talked a lot about the need to involve also stakeholders. to bring solutions down to earth and to bring it for in the public healthcare system in a stable way. In a good month, there is Christmas, and we also are expecting a new government. So are there, let's say, 1 or 2 or maybe 3 wishes to bridge the divides we talked about it you have and you will bring in the audience to make a closing round? What are the main wishes? 1 or maximum 2 per person.
Shall I start again, Romana?
Sure.
Well, the obvious wish is that for money, so I will leave that out. But what I would wish for is more courage, I guess we would say, in investing into pilot projects, pilot regions, you know, going a scale up from a tiny prototype to something that is bigger, and not the stakeholders having too much fear of these projects. Perhaps they would not fail, but they would not be a success after, you know, like 10 days or so. So these things need time. And this sometimes does not work really well with politics, with their 4 years re-election written. So that would be one Christmas wish, also already for 2025.
More long-term courage. Janne, what's your wish?
Doesn't have a sound.
Yeah.
Unmute, please.
Now I'm allowed. Okay. I wasn't allowed. No, mine is really short. I have some key points I always try to adhere to, and one is more doing and less talking.
That brings it down to earth. Are there even more wishes? Geja?
I would wish for an easier possibility to cooperate. So I think especially between institutes, it's really hard and a lot of obstacles in the way. And it would be so nice if we could just cooperate without all these hurdles and stones.
Thank you. Angelika, your wish?
Yes, my wish is that public health insurance would acknowledge services associated with digital health solutions.
Susanne and Gunnar, I will also invite you.
If I had a wish, political leadership and willingness to bring these digital solutions on the ground.
Yes. Last but not least, Gunnar will also bring
Okay,
your wish.
of course, I also want this very high quality collaboration to be continued between the institutes, especially here in this Salzburg region. And since it's Christmas, my wish is that in the next year, that patients entering our rehabilitation department do not only know their actual or at the moment their maximum oxygen consumption, but also their fitness they had before they became patients. This is my wish for Christmas.
I love all your wishes, and these are the best takeaways for the panel discussion. So thank you so much for your time.